It's a beautiful day at Lowenstein Chiropractic Center. I'm Dr. Tess Lowenstein, and today we'll be discussing the condition frozen shoulder and whether or not chiropractic can help. First question, what is frozen shoulder? It means a lot of different things to a lot of different people. There's different phasing, but what I can say for today's purposes, it's adhesions of the capsule, and AKA is actually adhesive capsulitis. The shoulder capsule can freeze up due to fibrous overgrowth, due to some nutritional imbalance, due to protectiveness from an injury. Either way, there's actually a kind of a question mark cause for a lot of the frozen shoulder issues. We do know that it's most common in women under the age of 40 and in the non-dominant shoulder. But beyond that, anyone and everyone can get frozen shoulder at some point, depending on their issues. One thing we do see it happening most commonly after, chronically especially, is after a motor vehicle accident, car accident, or a sports injury, something like that. Those are all things that can cause that issue in particular. Now, what can chiropractic do? Let's break down the phasing. The first phase of frozen shoulder is the pre-freeze phase. That pre-freeze is where you're kind of noticing some discomfort, maybe some limited ranges of motion, but nothing too crazy. It's not really inflamed, it's not very painful, and that's just the way that it is. So that's the pre-freeze. The next one we call acute phase. That's gonna be your nasty, painful, high level of inflammation, very limited range of motion, high pain, very high pain. That's an issue that we see most often coming in that we are more easily able to diagnose as frozen shoulder. The last one is chronic. Chronic is the one we don't want it to get to. It is completely frozen up. There's not a lot of inflammation. There's not a lot of pain, but there's also not a lot of range. It's almost completely immobilized. Our treatment methods would then vary based on the phase. During that pre-freeze, we would come in, we would do treatments around the shoulder, chiropractic adjustments, soft tissue movements, etc., and then hopefully resolve it very quickly and continue on with care. The next one we see would be the acute, and that one's gonna be a bit more aggressive. So we can tell that it's already getting to a point where it's about to freeze up, and that's not where we want it to go. We've been doing a lot of soft tissue movements in the area, passive stretching, a lot of range of motion movements, and then a lot of homework too to make sure that no matter what, even as painful as it is, that doesn't get to that point. The biggest time-consuming one is that chronic. If it's already frozen up, it takes a long time to unfreeze, especially with the treatments that we do. We do find though that research supports the fact that frozen shoulder symptoms improve 50 to 90% over the course of 1 year if utilized with chiropractic treatment, which is amazing. A lot of homework, a lot of stretching, a lot of passive ranges of motion, and of course a lot of chiropractic adjustment and soft tissue treatment. Those are all things that we can do to help this very difficult issue that so many people have to deal with. The last thing we'll say is we can also refer to a surgeon if necessary. Some people do find the need to seek out surgical consultation if this frozen shoulder just isn't getting better. And even though it is a long haul treatment system, we do recognize there's a need for that as well, and we will happily refer out should the case be necessary. If you think you do activities that might bring on a frozen shoulder, or you're starting to feel like you might have one as well, give us a call, 719-630-7032. We offer free consultations, so it costs nothing to come in and chat about your condition. We hope you have a wonderful rest of your day, and take care.